We are very happy and privileged to be joined by Dr. Brian Snyder, who joins us. He is a neurosurgeon with a fellowship in functional neurosurgery, the only neurosurgeon on Long Island trained in DBS, deep brain stimulation. He is the surgeon associated with Winthrop's Epilepsy Center as well. Dr. Snyder, welcome to The Dose.
Thank you for having me.
It is fair to say, I assume you would agree, that we are unlocking more of the mysteries of the brain each and every day. And as we solve these mysteries, it leads to more and more treatments for so many conditions. Talk about your specialty in particular.
Certainly. So the majority of what surgeons do is structural. If there's a broken bone, they fix it. If there's a tumor, they cut it out. If there's a leaking blood vessel, they repair it. Functional neurosurgery is a very small discipline that is focused on treating diseases such as movement disorders, epilepsy, pain, and psychiatric illness. And rather than trying to correct anatomic abnormalities in the brain, we focus on trying to restore the physiology, resulting in symptomatic improvement and significant changes in patients' lives, quality of life and ability to function.
And talk about deep brain stimulation, DBS.
So deep brain stimulation is an FDA-approved procedure currently for Parkinson's disease, essential tremor, dystonia, as well as for obsessive-compulsive disorder. In the future, we expect deep brain stimulation to be approved for other diseases, such as potentially even epilepsy, Alzheimer's disease, as well as depression.
So you talked about specific conditions and those who might turn to this as a way to improve their conditions. At what point would they reach that particular step?
Well, so the main patients we're treating with deep brain stimulation at this point in time are patients with the movement disorders of Parkinson's disease, essential tremor, and dystonia. And while there are specific criteria for each separate disease, the time that we think of surgery in general is when best medical treatment is no longer providing adequate symptomatic control. So this is not a treatment of first order, but nor should it be seen as a treatment of last resort. When medications aren't doing well enough, patients need to be evaluated for deep brain stimulation.
So at what point would a physician who is treating their patients medically and pharmaceutically turn to something like this, and when should they?
So again, this is symptomatically driven treatments. There's no test that tells us now is the time for deep brain stimulation. If an essential tremor patient has failed the medications such as Indoral, there are no other medications that are available, for instance, and the patient says they have refractory tremor, they can't feed themselves well, they can't dress themselves well, they can't sign checks well, they can't write letters to their family, that's the time for them to be evaluated. Similarly, for a patient with Parkinson's disease, they may have had the disease for 5 to 7 years. They may be developing dyskinesias associated with their medication despite optimal medical therapy. That's when we want to see those patients in evaluation.
How invasive is this procedure?
Well, this is brain surgery, so obviously it involves putting electrodes into some of the central areas of the brain, but it is still done in a minimally invasive fashion, and as far as neurosurgery goes, this is very safe. The way we do this procedure involves obtaining several sequences of images, typically an MRI before surgery. The day of surgery, the patient has a stereotactic frame placed, and then we go to the operating room. The patient, myself, and the team. Patient is awake with me in the operating room, and we slowly advance an electrode through the brain. We ask the patient to do things during this time. They may have to lift their arm. We may ask them to say the alphabet or something else. And by their performance on these tasks helps us to find the proper area in the brain. Different areas in the brain have different sounds on microelectrode recording. So we're actually listening to the cells in the brain to find the exact spot we want to put this electrode in.
Do you ever take a step back and say, you know, this 20 years ago, 25 years ago sounded like science fiction, and today it's science fact?
Well, I think that this is an incredibly exciting time to be doing these sorts of procedures. We learn more about patients and the neurosurgery and how the different areas of the brain are connected when we do these operations each time. And having a patient awake in the operating room with you, participating in the surgery, is an unbelievable experience, to say the least.
Absolutely fascinating for all those of us who have gone through surgery and, of course, woke up and asked how it went. In this particular case, you know how it went. You were a participant in the procedure. Deep brain stimulation, known as DBS. Dr. Brian Snyder, again, we thank you so much, neurosurgeon. Dr. Snyder, thanks so much again.
Thank you for having me.